entitled Publication and Presentation in different countries, Italy, United States, Spain, Czech Republic, Cuba, and Japan, and so on. And he has a cooperation and research project with the faculty of Milan, the way Parma, Zagreb, and Salamanca. Here we talk about radiology versus echocardiography in heart disease in dogs, right? Not that dogs. Okay, please.
Good morning. Io noto Ivano. First of all, I feel that I have to start with a lot of thanks. Thanks to society for inviting me, to give me the chance to visit such a wonderful city as Budapest. Thanks to Eva and all the committee for the strong work for having this symposium. Thank you for Claudio and Albert for starting the story of the society. Thank you to Fernando, my president, and thank you to Laura for a lot of things. I would like to remember to my US friends that Laura is Italian. It's the only case in Italian history of a scientist coming from abroad to Italy, not escaping from Italy. It was probably because love and food, but now Laura is Italian. Please, remember. Okay, let's start with the practice by the clinical point of view. Before speaking about radiology and sonography, I think we have to remember the pathogenesis of the disease in dogs, and this is quite different. I think that Clark tomorrow will show us the difference, because in dogs, heart disease is a chronic disease. And damages as first at the pulmonary, parenchymal, and arterial. It's very important to remember, just for taking a look of the whole clinical picture. So at the beginning, we may have no lesion at all. The dog can stay really well for a long time, months, maybe years, unless they have a very high work burden or they are a very active dog. And then we may have inflammatory disease. The clinical presentation is usually coughing. And then we start with arterial pulmonary disease that leads to pulmonary hypertension, syncope, as you could see, is the most typical clinical sign. And just at the end of the story, we may have a right heart congestive failure with abdominal effusion. This is very important to remember. Just taking a look to radiology and sonography. We know that radiology is very important for staging and monitoring the disease. It's very important because it's the gold standard for evaluation of the lungs and of the pulmonary vessels, mainly in this case pulmonary arterial vessel. Probably it's less important since we have sonography, echocardiography, for the evaluation of right cardiac chambers. We can see modification of cardiac silhouette on each frame. And it's less important about pulmonary venous circulation, because we have to remember that sometimes we have in Heartworm infected dogs concomitant heart disease. Maybe in small-sized dog mitral disease, in a large breed maybe dilated cardiomyopathy. So we have to take a look of different kind of cardiac disease that may be present in Heartworm infected dog. But it's important to remember that we don't have any kind of indication about worm burden with radiology. And this is really important to remember. And me and my old teacher, I know that now he's angry because I call him old, but I'm really proud to have Claudio as a teacher for parapsychology, but for many other things. And we did this study, it was a field study 12 years ago, tried to evaluate the worm burden in a live dog, so without necropsy, of course. And we could see that based on the antigen testing, semi-quantitative antigen testing, and based on the results of ultrasound, we have the higher worm burden in the middle-aged dogs, 4, 5, 6 years. We know that the lifespan of the worms are more or less 5, 6 years. After that, the worm burden starts to decline, but the damaging of pulmonary arteries and lungs increases with the age. This is very important because if we have just X-ray as the only tool for evaluating the dog, in this area, maybe we cannot find so severe lung arterial disease, but we have a lot of worms, so we can have a very dangerous situation for adult-design therapy. We have to remember that for a dog, an alive worm is less dangerous than a dead worm. So at the beginning, when the dog is young, we have a lot of live worms. Then the worms start to die because they are old, and then the worm burden starts to decline. So at the beginning, we may have a completely normal thoracic radiograph space with a lot of worms, and at the end, we may have a really awful thoracic radiograph with enlarged pulmonary arteries, enlarged cardiac silhouette, enlarged right ventricle here, and maybe very few or no worms at all. So if we base our judgment only on a thoracic radiograph, we can miss information. We can think that this dog has really few worms, and this dog has a lot of worms. So we can do some surgical mistakes. This just for remember the anatomy about radiology, which is gross specimens of a dog, and this we know we have the left atrium, the left ventricle, the right ventricle, the pulmonary vein that is ventral, the bronchus, pulmonary artery is dorsal. This is very important in the lateral view to remember, and this is the trachea. This is a not selective angiography of an airborne infected dog. We can better see the right atrium here. It's important to remember that in the lateral view, it's quite impossible to see the right atrium. We can see here the tricuspid valve, the right ventricle, the outflow tract of the right ventricle, the pulmonary valve, the pulmonary trunk, the left pulmonary artery that is dorsal, and the right pulmonary artery that is ventral. And about dorsoventral view, we may see the pulmonary artery in this position is more or less at 1 p.m. o'clock in the round clock of the evaluation. And we have artery, lateral, the bronchus is in between artery and the vein is medial. So in the dorsal view, we have to take a look at this. If we have a larger this part, probably a bulging of this part, probably we have a large pulmonary artery. This is very important for judging if we have a pulmonary artery disease. So when we are evaluating a thoracic radiograph for heartworm disease, we have to give answer to a lot of questions. The first one is pulmonary parenchyma damaged? Yes or not? And if pulmonary parenchyma is damaged, are pulmonary arteries enlarged? Yes or not? After that, is cardiac silhouette modified? Yes or not, of course. If yes, what about right cardiac chambers? We have to remember that in a heartworm infected dog, we can have concomitant heart disease. They are really common in mitral disease, really common in small breed dogs from 7 years on, from 7 years old on. And we can detect if signs of right cardiac congestive failure are present. Abdominal effusion, thoracic effusion. This is X-ray. This is coming from a positive dog antigen testing. We cannot find nothing. This is a pretty normal X-ray. So we know that parenchyma is okay, we know that the pulmonary arteries are okay, but still we don't know how many walls lives in this dog. And this is very important for the therapy. This is another dog, probably the infection is present since a few months, and we can see here a slightly enlarged cranial pulmonary artery. The size of the artery should be more or less the same of the vein. You see here the pulmonary artery, the cranial pulmonary artery is just a little bit larger than the vein, and probably here in the parenchyma if we have some interstitial pattern. So probably we can start to have some problem to the pulmonary parenchyma and arteria. So we know that this dog is not completely normal about pulmonary circulation. The enlargement of the pulmonary arteries is clearly more evident here. And this situation, I remember, it occurs months or maybe here after the infection. And the damaging is more obvious here. You can see very large pulmonary, cranial pulmonary artery. Even the truncus probably is large because the trachea is displaced dorsally and the parenchyma is not completely normal. We have some interstitial, maybe bronchointerstitial infiltration. So this situation is not a normal situation. This dog starts to have a severe damaging of pulmonary arteries and parenchyma. Situation is going on in this dog. Take a look of the cranial pulmonary artery. It's very huge. You can see the bifurcation of the cranial pulmonary artery here. You may see the truncus here, probably because the trachea is displaced dorsal. And you can see that pulmonary parenchyma is not normal. There is a interstitial and some maybe here a very pattern in the lung. So we know that this dog had a lot of damaging coming from our lung infection. So we have to be very careful to treat this dog with adulticide therapy. And this is probably even worse situation. Take a look of the both cranial pulmonary artery, how they are enlarged. Take a look of the main pulmonary artery, bifurcation, the left pulmonary artery dorsally, the right one ventrally, and here we have a pruning of the right pulmonary artery. Probably we have a thrombus here. There is no more flow in this part of the lungs. So this is very, very bad situation by the clinical point of view. Probably we can treat this dog, we can clean heartworm disease, but this dog will be never normal for the rest of his life. This is really important about prognosis. To clean heartworm doesn't mean to have a complete remission of the disease. This is very important for staging the disease. And this is even much worse situation, very huge right cranial pulmonary arteries, here, very severe pulmonary parenchyma, damaging here, and probably we can see a very enlarged right ventricle because the apex of the heart is displaced dorsally. So this dog probably has severe pulmonary hypertension, but still don't know how many worms live in this dog. And another situation, pulmonary artery is still enlarged, and enlargement on the right ventricle based on cardiac silhouette. The apex is displaced dorsally. We have a severe parenchymal pulmonary damaging here, but we have still area like here that are completely dark. We cannot see any kind of flow here. Probably we have a lot of thrombin in the pulmonary circulation. So this area, we have just hair, but no more blood flow. And this is the end stage of the disease. Take a look at the cranial pulmonary arteries, is enlarged. It seems like a snake, and for sure we have pulmonary hypertension in this dog. Pulmonary parenchyma is damaged, and we start to have a thoracic effusion. Probably we have abdominal effusion. In Heartworm dogs, usually abdominal effusion starts before thoracic effusion, and the pulmonary trunk is large, the uvular trachea, how much is displaced dorsal. And about ventral dorsal view, we can see in severe cases bulging at the pulmonary artery. This is the pulmonary trunk, is really enlarged and is protruding of cardiac silhouette. And we can see here the right pulmonary artery that is very enlarged. Usually, the right pulmonary artery in heartworm infected dogs is more damaged than the left one, and more worms live in the right pulmonary artery than in the left pulmonary artery. Now we can speak about sonography, echocardiography. We can use widely this kind of tools nowadays. We started in 19 to use in veterinary medicine echocardiography, and now we have almost all practitioners can use sonography. It's very important for staging and monitoring the disease and giving us information about the best kind of therapy that we can apply for this kind of disease. First of all, we have to focus on pulmonary arteries. We know that the adult worms, they don't live in the heart. They may be displaced in the heart in such a situation, such as Cavall syndrome, but this happens at the end of the disease when they have severe hypertension, and it's not a good situation for the dog because the dog is going to die in a few days, and even not good situation for the worms, because even the worms are going to die, and this is not good for the parasite. So this is Cavall syndrome is an end-stage disease both for dogs and for the parasite, and by dimension of echocardiography we can see how much are enlarged the main pulmonary artery and the right pulmonary artery here, and here. Of course, is subjective feeling, but we know that aorta, this is a short axis view that is in the center, should be the largest vessel that you have in the body. But pulmonary artery is the largest of than aorta in these dogs, and this is not normal. Probably we have a severe pulmonary hypertension in this dog, and this is important for prognosis because this dog, even if we clear all the worms, will be not completely normal, and we have to be very careful to practice alloticide therapy in this dog. About pulmonary arteries, we know that there is a flow in pulmonary arteries, and when the situation is normal, the diameter of the pulmonary artery system is larger than in diastole. So we can extrapolate an index. We can call right pulmonary artery the extensible index. That means systolic diameter less diastolic diameter divided by systolic diameter. If the situation of the pulmonary arteries is normal, you can see during systole enlargement on the pulmonary artery because the flow, and because the pulmonary artery is very elastic at the beginning, and they start to decline with the time, and at the end of the disease, when we have severe hypertension, you probably cannot see the difference between systole and diastole. This pulmonary artery, we are speaking the right pulmonary artery, this is the pulmonary vein, this is the cross-section of the right pulmonary artery, this is a wall, and probably this kind of arteries are completely damaging, and there is no chance for the sensibility, and this dog for sure severe pulmonary hypertension. And we can have a subjective look even of the right cardiac chambers. Usually the right ventricle is much smaller than the left ventricle. We consider 1/3 of the dimension of the left ventricle, but the right atrium and the right ventricle in this case are much larger than the left ventricle, even in this case. And in this short view, we can see even what we call paradoxical central motion. The septum is moving toward the left ventricle, and in the pulmonary, in heart disease, we have usually systolic paradoxical motion. That means we have pressure overload. In other kind of disease, such as tricuspidal dysplasia, we may have diastolic paradoxical central motion, that means volume overload. Of course, together with the dimensional and monodimensional jet plane, we have a Doppler apparatus, very useful. Color Doppler is useful for detecting hospital pulmonary regurgitation, that starts when we have hypertension in dogs. Sometimes we may have very mild hospital or pulmonary regurgitation. This is quite normal, pulmonary regurgitation in 90% of dogs, but it is low velocity. And we can check with the continuous wave Doppler the velocity of the flow. And with the Bernoulli modified equation, we have an assessment, very nice assessment of the systolic and diastolic pressure in the pulmonary arteries of a Heartworm infected dog. We have just for systolic pressure to have a look at the velocity of the hospital regurgitation. We are speaking of very high velocity, in this case close to 5 meters a second, that means 100 millimeters of pressure, systolic pressure, and we can measure the velocity here of pulmonary regurgitation. We can have a measure probably less nice, but we can have a measure of diastolic pressure in the pulmonary arteries. But ultrasound, sonography, cardiography allow us to even visualize the worms. This is the way with the worm. We are speaking about Dinofilarium mitis because we don't have longitudinal ridges that are typical of Dinofilarium repens. This is the worm in a glass of water, and you can see the cuticles here. This is the typical way that we can see Heartworm in a vessel of the dog. So we cannot see the whole worms. We have to remember that this echocardiography is a section. So we can see section of the worm, but the typical imaging is a double line, like here, like here, like here, like here, like here, and here. There is a lot of filarium that were made in the right pulmonary artery. And it's a very important Heartworm visualization in cats mainly, but even in dog, because we can roughly estimate the worm burden and where the worm are located. This is important for the therapy. About the diameter, sometimes we may have some mistakes because aorta can create some mirror effect, and it's important that the echos should be floating in the vessel, and diameter is 1.3 millimeters. And if you want, probably you can have a distinction between female and male worms. Female are larger and are more hyperechoic than male worms that are thinner and less echoic than female worms. And so, about sonography, our focus is on pulmonary arteries. In the past time, when it was very young, almost in every book was written that pulmonary arteries can be assessed just by the right side with this kind of view. Is a short axis view in the center of the aorta, right atrium, right ventricle, pulmonary artery here. A lot of filarial work. You can see here very nice. Probably this is a male because it's not so bright as female are usually to be. But now we know that we can check pulmonary arteries from each part of the body. Probably in the future we discover that we can assess pulmonary artery even from the nose of the dog. So we can assess from right side with a long axis view, left ventricle, left atrium. Here we have pulmonary arteries. This is a close-up view. This is the vein, longitudinal view, and this is the very enlarged right pulmonary arteries. This is on the top of the left atrium, and with a lot of filarial worm inside. But we know that we can see clearly and very nicely pulmonary arteries with the transhepatic supersulfidea view. This is the aorta in the center. In the past, we used this kind of view mainly for Doppler to check the velocity, the flow velocity of the blood in the aorta. But now we know that we can see here the right pulmonary artery. You can take a look. There is a worm inside the right pulmonary artery here and here. And from the cycloidal view, if we go caudally, we can see the left atrium here. This is the mitral valve, and we can see a large right pulmonary artery with a lot of worms inside. This is important for the therapy. Radiologists cannot tell us how many worms live inside the dog. Echocardiography does. It's very, very important to remember. Still, from a superior view, we can see here the right pulmonary artery, the aorta. So, and more caudally, even the pulmonary artery close dorsally to the left atrium. We may have this view from transhepatic view, even of the outflow tract of the right ventricle. This is pulmonic valve. This view is probably less important for heart disease. It's probably much more important for example, for pulmonic stenosis or for PDA. You can see very nicely PDA from this view in dogs, and you can check the measure of the pulmonary stenosis of the measure the dimension of patent ductus from this view very nicely. And we can check the pulmonary arteries even from the left side of the dog. We are speaking with the dog with the left recumbency. This is the outflow tract of the right ventricle, pulmonary valve, a lot of worms just close the pulmonary valve. It means that we have a lot of worms because at the beginning they prefer to stay away in the distal part of the pulmonary arteries. They don't live to stay downtown. They don't like to prefer at the beginning to stay in the neighbors, in the country, or the lungs. But when they start to be very a lot of worms, they are going close to the heart. So a lot of vehicles here. And just with the side rotation, you can see the right and the left pulmonary artery. Here we have the pulmonary vein. We have a floating filial worm vehicles. In the center we have the aorta. And this is the right ventricle. This is important view. And this is important in our Heartworm-infected dogs. Check pulmonary arteries from all this kind of view, from the right side, from the subsequent view, and from the left side, because we can gain a lot of information. Because we have to choose the therapy. And this is our second goal. And about the therapy, when I was very young, and I remember when I was very young, I was almost fresh graduated. I was in Milan. I was a meeting about heart disease, and I remember Professor Jenkins was still speaking at that time. I was 25 years ago with David Dart. I miss him a lot. And at that time, about glutathione therapy, we used to have a lot of different classes. Very mild risk of thromboembolism, mild to moderate, moderate to severe, severe. Too many. Because if we are speaking about the risk, we don't have to speak just about the frequency of an event. We have to think about the severity. For example, if we have a very dangerous disease like tetanus, for example, in human beings, it's not so frequent, but it's highly risky. If we have a cold, it's very common, but it's not risky. So, if we are speaking about thromboembolism, we have to remember that this is the statement of American Heart Society guidelines. Pulmonary thromboembolism is an inevitable consequence of a successful glutathione therapy. So we always have pulmonary thromboembolism. So we cannot avoid. Maybe we can have very mild subclinical thromboembolism, But if you want to kill the worms, we know that they are going to create thromboembolism. So we have to watch for coughing after adult therapy, fever, dyspnea, hemoptysis, lipotemias, or syncope. So mainly if you are using melastomine the second week after following the therapy. I think that we cannot speak about risk of thromboembolism. We have to speak about risk of death. This is much different. And to calculate the risk of death, we have to take in account for adult-decide therapy. Worm burden, how many worms? If we have a very large worm burden, of course we are going to kill a lot of worms if we wait for a very dangerous thromboembolism. And the disease, this is proliferative endocarditis, that is quite typical, it's a marker of disease. And this kind of damaging is lasting even after the worm disappears. So this is arthritis will be not normal at all after the dog is cured for heart disease. So we have to take in account worm burden and pulmonary arterial disease, the two most important things. Speaking about the risk of death, not about the risk of thromboembolism. Because we know that thromboembolism, never mind the kind of adult-decide therapy we are going to use, melastomine or doxycycline plus ivermectin, we are going to have always thromboembolism. So this is, at least in my opinion, I don't know if it's all the people from my society or from the American society agree with me. I think if we are speaking about risk of death, we cannot assess different classes of risk. We have just two classes, low and high. And I think that we have a low risk of thromboembolism and dying when we have a low worm burden and non-parenchymal and pulmonary vascular lesions. And dogs included in this group must satisfy all these conditions. No symptoms at all, normal thoracic radiographs, low level of circulating antigen or a negative antigen testing with circulating microfilaria, that it means that maybe we have just one or two female worms and maybe one male worms. No worms visualized by echocardiography, no concurrent disease, and very important thing, we have to be sure of the compliance of the client. That is very important, exercise restrictions. We need a very compliant client. And if at least one of these conditions is not satisfied, we have to consider the dog with highly risky for adult-decide therapy. So if we have a dog with symptoms related to the disease, coughing, syncope, swelling of the abdomen, if you have a normal thoracic radiograph, high level of circulating antigen, worms visualized by ultrasound, concurrent disease, and not compliant illness, we have to consider the dog to be sure with high risk of death following adult-decide therapy. And the only therapy that allows to avoid completely thromboembolism in the surgical therapy, I regret just a little bit because I really love this kind of therapy. I regret that was not mentioned by the SCPA guidelines, and there are just a few sentences in the American Store Society guidelines. But I think that this kind of therapy should be the therapy of choice in human beings if they were affected by heart disease. I don't think that any man or woman with worms in the pulmonary arteries could be treated with melastomine, doxycycline, or ivermectin. I think that human physician could get out the worms from the pulmonary artery because it's not sure. It's the only way you cannot have thromboembolism. So, about surgical therapy is, of course, is the only therapy if you have a combat syndrome. It's compulsory to do this kind of therapy. We don't have time for any kind of adult-decide therapy. But, in my opinion, it's strongly advised if we have a high worm burden. Because in this way we can avoid thromboembolism completely. We can remove the worms without killing them. This is very important for the safety of the dog and even for the follow-up, because the dog can survive, maybe the thromboembolism, maybe can survive a severe thromboembolism, but the damaging of the lungs and the pulmonary arteries, they stay, and the dog will be normal, not normal, for the rest of his life, and this is important. This kind of therapy starts from the Japanese school in Gifu, in altitude, and they create this kind of forceps through the heart. This is cranial vena cava, this is right atrium, right ventricle. We have more or less here the pulmonary valve and pulmonary artery. With fluoroscopy, we can go inside the pulmonary arteries and remove the wall. But this kind of therapy may be improved in terms of efficacy, because now we can couple fluoroscopy with transesophageal echocardiography. You can see we can get the pulmonary arteries with the fluoroscopy. You have a wall here in the right pulmonary artery. This is the organ. Again, you can see the wall, and then you can see the tip of the forceps grabbing the walls and keeping out from the pulmonary artery. So this kind of coupling transesophageal echography to fluoroscopy, we have a higher removal rate of worms, and we can see where they are located, so the procedure is shorter in the time, and I think it's safer. I think that should be a very safe and option for dogs with a high work burden, and should be spread in every country, because it's not difficult, it's not a real surgery, and it takes a few days to learn basic things about this. I want to tell you, maybe I can ask some friends some questions. We have two dogs here. They are a crossbreed dog, Zoo, female dog, and Bobby, male dog. Both of them are in Heartworm infected. We have clear different thoracic radiograph. This is the radiograph of Zoo, and this is the radiograph of Bobby. What do you think is worse? Nena? Nobody? Okay, if we take a look at this, we can see a huge cardiac silhouette and really enlarged right vent. Our feeling is, okay, this dog is very bad about heart disease. But what about pulmonary arteries? They are pretty normal. And so we know that the disease starts from the pulmonary arteries. So in this case, we have a huge right ventricle without enlargement of the pulmonary arteries. This sounds strange for heartworm infected dogs. And we have echocardiography from Zoo. We can see very normal right ventricle, not enlarged, very nice left ventricle. But Bobby has a huge right ventricle, right atrium, very small inside, and we can see even monodimensional that the right ventricle is huge and large, and we have some kind of arrhythmias. In taking a look at pulmonary arteries of the Zoo, we can see that the pulmonary arteries are not enlarged, but we have a lot of FEDAD work equals here. So probably we still don't have a pulmonary hypertension, but we have a really very high work burden. And if we take a look at Bobby, you can see huge right atrium, huge right ventricle, probably enlarged right ventricle, still a worm here. Take a look at the tricuspid valve here at the cross-section view. There is a worm inside. So the right cardiac chambers are really enlarged, but the pulmonary arteries here doesn't seem so bad. Why the right ventricle is enlarged and the pulmonary arteries are? No. It's because of heart disease. So we can see with the surgery Zoo, we could remove almost 20 worms. This was a small female dog. The weight was 5-6 years, more or less. And we can measure the velocity of the pulmonary, the tricuspid regurgitation of Bobby. And so we could estimate that the pulmonary pressure was pretty normal, and this was rhythmogenic right ventricular cardiomyopathy in a dog with Heartworm disease. So it's important to remember, if we have a positive antigen testing, that not always Heartworm disease is the only disease present in these dogs. We have to justify every kind of lesion we can detect with X-ray or echocardiography, and with the pathogenesis of the disease. It's very important. I think it's the way that we always to be treat every kind of disease. I think that practitioner as me, mainly in the country where Heartworm disease is spreading, should know the pathogenesis of the disease for the best interpretation of clinical or radiological or sonographic results. This is the last slide. I like this slide because I like this sentence from Mahatma Gandhi, but I like my old dog Rufus, but I miss 1 year ago. Thank you for your attention.
Thank you, Luigi, for this interesting presentations. Some question? Yeah. Okay. There is no question.
Just one month. I want to thank a special friend that I have in Budapest. His friends. That was a fantastic guide for me in Budapest, and wonderful city. It's much wonderful, but you have people living in the city that guide you the best places and the best restaurants, of course.
Okay, so we can continue. The next speaker is Dr. He will present importance for microgravity